Good morning, listeners and viewers. You're listening to
Morning, Ammar.
and
Jalf.
live on Spice FM.
And each week we'll bring some views, news, and one or two clues from the business world.
Asian Business Connections aims to connect, support, and promote the Asian and wider communities.
And we'll be talking shop quite literally and not just corner shops. So they're looking to start a business, have an existing business, or you just want to talk business, we can help.
So Jalf is undercover this week. It looks as if it's almost like day 27 in the Big Brother house.
Something like that.
Yeah.
I've got my big hoodie on, but I better not put that on. I'm kind of parked in a car park just across the river, and I can see the sage just in front of me.
Right.
Things that we do to do the show.
Yeah. Well, it's coming live and loud, and delighted this week to have a special guest on, Dr. Naveed Azam, who's going to be joining us to talk particularly about the flu vaccine and clearly just general health as well. So we're delighted to have Dr. Naveed on. It's a very interesting week. Thank you once again, Jalf, for hosting our guests from Turkey. So Chris and Gultan. Chris was here. He is the president of the Chamber of Commerce in Turkey, and Gultan is his wife, and our brother is Mustafa Souza, and they are quite a significant family in Turkey as well.
They're very, very lovely. They're very lovely people, and it was just a pleasure to be able to host them. So it was a really lovely evening as well.
Yeah, no, and it was nice for Imran and Gainford Group to host, the ABC award winners and key stakeholders. Appreciate that. We were. Some people were unable to attend, but we still had a great turnout, and it was just a nice venue and a nice place and space to celebrate the significant and sustained contribution of the Asian community. That is almost not recognized or appreciated as much as it could or should be. And what is particularly important about doing so is that it highlights to others that you can work hard and achieve. And then it was beautiful and wonderful to be able to show off your venue at Kai Kai, the multi-award winning best restaurant in the UK and one of the foremost places and spaces globally with such quality-driven, unique dishes and experience. So they were blown away at the cuisine, their responses at the type of ingredients and the manner at which you prepare and serve those dishes. It was a wonderful thing for me to sit and see their reactions to the food, which was great. So well done, Jalf. Thank you once again. So this week, our business topic of the week is identifying risks, Jalf. And it's as the Plan B COVID restrictions were announced earlier this week, many businesses are having to reassess their plans for the next few weeks and months. Are you?
Well, of course. I think this time around, they haven't hit hospitality as hard as what they've done in the previous years. I think they've made some sensible decisions. Because let's say in hospitality, you are seated whilst you're dining, and you're only getting up to get off your seats when you would only be going to the washrooms. So it was nonsensical how you could have the shops were open previously and the restaurants were shut, which was very, very illogical. So I think they've made it a little bit more sensible on this occasion, that they don't have that social distancing, they don't have a rule of 6 and a meter apart and this, that, and the other. So from that standpoint, we're okay for now. Yes, there's been a huge number of cancellations on Christmas parties. It's just people have just, because it's the feel good factor, isn't it, Ammar? I think as soon as especially the healthcare organizations, nursing homes and the rest, they probably feel it's not the right time for them to go out and have a Christmas party. I mean, I would say that you should go out and have a Christmas party because it's been such a tough year. Come out safely, and there's no reason for you not to do that. But we've had to obviously adapt our business model and really be very, very super focused on the cancellations and try and fill those covers the best that we can.
Yeah, so ultimately, there still remains a big challenge, Jalf, and the reintroduction of restrictions is a risk that all businesses have been facing since the first lockdown in March 2020. But,
well, of course.
But ultimately, just thinking about risks in business, you cannot start a business without taking risks. Choosing to launch your business is inherently a risk. There's no guarantee on success, but you shouldn't do so without the mindset of being able to overcome any of these risks. To help with this, identify them in advance and have a plan set in place to fight them in manageable levels. Of course, you cannot predict every possible problem that can materialize, but the more you try to anticipate them, the easier plans to deflect them can be. Risks can come in a variety of forms, so external incidents. These are the more difficult to predict, but the probability of them occurring is lower than others. For example, floods, fires, or pandemics. But even with a low chance of these happening, these are disastrous events with great impact, so great that you need contingency plans to deal with them. You should identify these risks as part of your market industry analysis, as these risks will generally affect your whole industry. So think of how your competitors might react to gain an advantage over you in the recovery. And then you've got internal incidents, Jalf. The range of risks in this category are varied depending upon how your business operates. For example, loss of supply, malfunctions with machinery, product contamination, etc. Use scenario planning. So scenario planning to find these risks when identifying your key activities. Based on the threats your organization faces, you can explore scenarios about the results before they materialize and find a possibility that makes life easier to move on from it. So possible risks or pre-launch delays or any of the pre-launch key activities likely to cause delays, competitors, what are they doing? Competitive advantage, is it being eroded? Market, how is it changing? Customer value proposition, is it being delivered? Product, service, quality, is it adequate customer service? Are they satisfied? Cash flow, is it adequate sales? Are you meeting targets? Profit, are you meeting targets? And there's a whole range of other areas that you should and could consider, Jalf, when it comes to risk. One of the key exercises that we have, where you gone?
I'm still here. I just got the phone calls.
the one of the key exercises that we introduced this year, Jalf, was a pre-mortem.
Right.
It's a bit like a post-mortem, but you do it before it happens.
Yeah.
Right? So you get your team together and you go, right, we're launching the restaurant, or we've got our busiest day of the year, or we're just at capacity with bookings, and we've got this big event, or we've got a big celebrity, or whatever it is. It's a substantive part of, and you can do it on a weekly basis if you so want, as in next week, what could go wrong? Right? And approaching things in that way, and looking at that, and getting the team to brainstorm, and like everyone comes up with ideas, what can go wrong? And interestingly, right, it's an easier question for people to consider because of the inherent nature of us all, that we're so negative, that it's far easier to think about what could go wrong as opposed to what could go right. Right? So all of a sudden, you have this huge and substantive list of here's all the things that could go wrong next week. And in doing that, you then spend equal amount of time going, okay, how do we mitigate that? How do we either prevent it or prepare for it in the event of it happening? Because there's certain things that you have limited control over, like the government announcing on Monday that we're going to go into full lockdown. But there's some element of preparation of that. There's an element of consideration. So immediately, things like getting a finer, better balance of stock control, looking at how might we sort of make sure that we are prepared and can pivot immediately to takeaways or whatever that is. How do we make sure that the flows of customers and orders and whatever that is as effective as it can? And what happens if we lose 20, 30% of our staff? How do we effectively deal with that?
I mean, there's all sorts of problems that you face. I think critically, you have to be able to move very, very quickly. But I think along with that, I think this is the moments where the little operators have a little bit of an advantage, because this is the time where you have to bring out your entrepreneurial kind of savviness. You have to make on the hoof decisions. You have to follow your gut instincts, but then you have to make the right decisions. The corporate organizations, the big operators, by the time that they kind of consult their departments and make the decisions, it might be too late. So I think, following your gut instincts is really, really important, because sometimes you just don't know what the right answer is from the wrong, because there's not really a rule book, is there, Ammar, in these instances, and every business is still unique. And the other big challenge is, let's say that you follow your gut instincts, you make the correct decisions. The other problem is you revert from a restaurant to a takeaway, let's say in hospitality, and your supply chain is absolutely decimated. And that's where the problems begin. How do you deal with that? So we know globally there is huge issues still on the supply chain. They're still playing catch up. Anything to do with craft, anything to do with boxes and those particular ingredients, let's say, whether it's pulp that you make the craft boxes with, they've been under so much strain. If you imagine, Ammar, the amount of Amazon brown boxes have been going through people's doors. I mean, you can't just globally, if that supply, the demand increases, 100-fold. How do these little operators cope with it? And if we're in that supply chain against all the big boys, I mean, there's nothing that we can do but to wait an extra 4 weeks, 6 weeks just to get some supplies over from China, wherever that may be. So that's another huge issue. And how on earth do you plan for that, Ammar? Because we've been thinking for a number of weeks that, yeah, there might be a lockdown in December when it's going to be the height of the flu season and this, that, and the other. But then we're thinking, okay, let's try and order in advance. But then where on earth do you store all of these goods? You know, there's so many other concerns. And even though we managed to get some storage ready, we spoke to our suppliers and they're saying that, look, they can't do anything until February. So that's the kind of problems that we are facing. It's more macroeconomic problems as opposed to micro ones that we could potentially solve ourselves.
Are there not then local suppliers or?
Well, ultimately, if you're looking to get a bespoke bag made, obviously it's always going to come out of China, aren't they?
Well, not necessarily, because actually Turkey is a significant manufacturer and producer of goods.
Yeah, I think you know, when you're using agents that you've worked with for many years, and they have access to the supply chain, and they go around different factories around the world to try and source a particular product for you. It's difficult for me to say to them, oh, go and explore the Turkish companies unless they are well known and they're known to him and they've done business with him, or maybe that's a contact that we could certainly try and put together.
But I actually already have a series of credible Turkish businesses that we've worked with that can provide a number and series of goods.
Yeah, I mean, that's something that we can definitely look at and explore. But I'm just saying, generally, there is those supply chain issues that a lot of people are suffering from at this moment in time. I mean, there's so many things, Ammar. There's so many issues with the supply chain. We have a business vehicle, and it's waiting for a part from Germany, and it's been out of action for 4 months because just waiting for this part, and we can't get it. We can't do anything about it. And the new cars, there's a certain kind of chip or something that they need. There's only one manufacturer in the world that makes it, and they can't cope with the demand, and hence old vehicles have gone up in price because the new vehicles, they're not coming out, they're not churning them out as quickly as they can. So there's still huge issues that the world is facing. And if there's going to be further disruption ahead, and when we haven't even caught up on the disruption that's being created, I just worry, you know, what it's going to do to the supply chain. Never mind the restrictions that we have to deal with in the UK, but to be able to function businesses properly, and the supply chain is not delivering. You know, it's going to, if that gets worse, we're going to be in big trouble as a nation.
Don't doubt that. And for me, some of the biggest challenges. So I was talking to our FD. I talk to her every Friday morning, and as you're aware, she also works with several hundred thousands of other companies as well. And some of the biggest challenges, Jalf, that businesses are currently experiencing are supply chain, like to the point whereby some of them have actually had to be wind up. Right? So, particularly in the building trade. So on one hand, the demand for the building trade and builders and all of those trades and, you know, maintenance and all of that has increased so significantly. It's incredible. But on the other, the impact of supply chains and supplies and materials is such a challenge that basically people have, organizations have ordered things, the supplier hasn't been able to get them, and because they haven't been able to get them, they haven't been paid. And because they haven't been paid, they simply can't sustain. And there's a whole host of these affects and effects that are impacting so many.
Yeah, people. It's very worrying, but I mean, I just can't. You see, that's like I said, I'm how on earth? What type of contingency plans would you have if the entire nation doesn't have any supplies? I mean, you know.
But if you look at, if you look at the model, the current model is wholly dependent upon goods and manufacturing taking place internationally. There's an opportunity to onshore some of that production. This has been demonstrated in such a big way in Cramlington, right? The private and the public sector, the NHS came together, right, worked together, and they've got a manufacturing plant up in Cramlington making PPE, and they're producing thousands, tens of thousands of products and supplies. But it just demonstrates the power of planning and contingency. So if packaging is a big issue, then why aren't we looking at, sort of mobilizing some of the mothballed plants that aren't doing things and converting them into whatever that is? I just think there's a better, more innovative way. Anyway, delighted to have Dr. Naveed Azam on our show this morning. He's in the waiting room, so I'm gonna, he was in the waiting room. Good morning. Dr. Azam, can you hear us? Hello? I'm hoping Dr. Azam is there. We can see him as a participant. Don't know whether he's connecting or not. We were expecting. We'll continue, Jalf, because obviously conscious that we're on air.
I'm sure the good doctor will. I'm sure the doctor will intervene when he's ready.
So the thing is, Jalf, there's some inherent risks in all activities. I think the key thing is that we try and support as many organizations as we can. And the most principal point of our ask or advice is that contingency and risk planning is a really important aspect to any organization, and not just businesses. Think that through. Look, the storms over the last couple of weeks, Jalf, have been horrific. There was some 200,000 homes affected by that, and a number of those continue to be without power. Dr. Azam, are you there?
Not yet. No. Oh, there you are.
Hello.
Hi. It's Ammar and Jalf, I believe.
It's Ammar and Jalf. It is. Yes. Good morning.
Hello, doctor. Good morning.
Morning to you both. Morning, and thanks for having me on the show.
No, pleasure. Thanks for giving up a little bit of your time for joining us. we were talking about you and talking more broadly as well. So if you can hear us and see us okay, would you care to introduce yourself, say who you are, what you do, and why you do it?
Yeah, thank you. Yeah, so my name's Dr. Naveed Azam. I'm a GP in Middlesbrough. Been a GP now, well, I've been a doctor now for almost 15 years, and GPing in the area over the last 5 years. And why I do it, you know, obviously, from my perspective, it's the best job I could have personally have done. I'm very lucky to do it and to help the local community.
Fantastic. And it certainly is an admirable job to do. And we're delighted that you're doing it as well. So, so well done. 15 years is a good innings as well, Dr. Azam. You know, obviously you've seen a number of changes. Anything like the pandemic, or is that a silly question?
Well, it's unprecedented, isn't it, really? Absolutely. Came out of the blue. You know, we had a few scares over my career, you know, with kind of bird flu, swine flu, etc., but nothing to the extent we're living through at the moment. It really is unprecedented. And I think it's times like this that we all need to really come together and come together as a people and come across solutions that will really help to, you know, make everyone's lives better. I know we're going through a very difficult time at the moment, and that's one of the reasons I'm on today, just to discuss some of the important aspects of health, not just COVID. I know COVID's been in the news a lot, and obviously with the new Omicron variant as well. But actually, I wanted to really focus today on an older enemy of ours from a microbial perspective, and that's flu. The simple flu, which is often overlooked when it comes to how serious it can be, especially with the focus today and over the last year and a half being mostly on COVID and the coronavirus. Today, I wanted to talk a little bit about the coronavirus, but also in more detail about the flu jab and really get our listeners to consider getting the flu vaccine, because it makes a difference, especially to that group of patients who are at risk of serious disease when they have when they unfortunately get the flu.
Well, and thank you for that. You know, interestingly, you know, Jalf and I and the wider family, we've all sort of been suffering from other ailments, you know, sort of cold and such like. And it's interesting that everybody's focus seems to be you've either got COVID or nothing, whereas actually your point around an older enemy is very, very poignant and you know, on point, because lots of people are sort of thinking, right, I need to get my COVID booster or my vaccine and things like that. But tell us a little bit of background to the flu itself, and because it's been around for quite some time, hasn't it, Dr. Azam?
Oh, absolutely. You know, flu is an ancient, well, not ancient, but a long-standing illness that's been affecting people for decades now. The interesting and kind of annoying thing when it comes to flu is that it changes every year, and therefore can cause serious disease in a specific group of people. And you know, obviously, with the focus being on the pandemic, the flu seems to have taken a bit of a back seat. And like I said previously, what I wanted to go over today is really talk about how getting the flu vaccine, which is something we'll talk through in more detail, is really important, and it makes a difference to people's health.
Doctor, when you say it affects a specific group of people, the flu affects which specific group of people does it actually affect more than another group of people?
Well, obviously, the flu can affect and cause illness in everybody who potentially can get it. But there are a subsection of people that should be getting the vaccine. And that's those people that are aged 50 and over, are pregnant, are a carer, or if they have any like specific medical conditions that could potentially put them at a higher risk of serious disease if they get the flu. A little bit similar to that group of patients that was shielded very early on when the coronavirus pandemic came about. So that group of patients can get more serious illnesses when they get the flu. So they're the actual target group of people that should be attending for flu vaccinations. So once again, just to go over that again, it's those patients that are 50 and over, or are pregnant, if they're a carer, or if they suffer from certain medical conditions such as diabetes, COPD, that can potentially cause more serious illnesses. Also, obviously, children are issued flu vaccines as well. A little bit different to an injection. It's actually a nasal spray that they kind of inhale through the nose. So it's a lot nicer than having an injection in the arm.
Good. I mean, they're the priority groups, Dr. Azam, that you've made reference to. But in effect, really, we would be encouraging everyone to try to get the flu vaccine. Would you, or would you suggest otherwise?
Well, absolutely. I think these priority groups that I've mentioned, we need to really get them vaccinated. Other people can get the vaccine, but it's not going to be something that the NHS will be covering from a payment perspective. I mean, if you're not in those groups and you'd like to get the flu vaccine, you can get it, but it will need to be something you pay for.
I just do know lots of people who do, as a precaution, just go and pay for that as an opportunity to prevent themselves from potentially getting unwell, because it's not necessarily just the flu that would impact those groups, is it, Dr. Azam? It's the subsequent or underlying health conditions that make it slightly more dangerous.
Oh, absolutely. If you're suffering from things like airways diseases, for example, COPD, or if you have something along the lines of a diabetes type illness that can affect the way that you can deal with infections, it obviously makes more serious disease potentially likely. For example, more serious cases of pneumonias, or even more serious infections, especially if your underlying health is not optimum, because you're suffering from other illnesses that can affect it.
And how do people who are and may not have necessarily got the communication, undoubtedly they would have got some communication, but how do people get the flu vaccine, especially those groups that you made reference to? And if we think about the ethnic and Asian community, there's a higher proportion of them with diabetes and things like that, Dr. Azam. How do they go about getting the vaccine?
Well, some very simple methods to get the vaccine if you're eligible. First of all, as a GP, you can always contact your local GP and ask about your eligibility and ask for an appointment if you are eligible. Pharmacies is another excellent point of call when it comes to getting the vaccine. And finally, the last thing that I really wanted to cover with regards to how to get the vaccine is some COVID vaccine booster locations are giving the COVID booster as well as the flu vaccine, and it is completely safe to have both at the same time. Almost think of it as two birds with one stone, so to speak.
Okay. No, that's helpful, and just some of the misnomers about the vaccine and things like that. Are you able to share and dispel any of the sort of myths that exist?
Oh, absolutely. I think it's a really good question. There's a lot of, like you mentioned, issues surrounding, people being hesitant about vaccines. So I like to break it up into people who are hesitant to have a vaccine and people who are vaccine skeptic or anti-vaxxers. Now, thankfully, I haven't actually, in my clinical work, I haven't actually met a lot of complete anti-vaxxers, but I've met people who are hesitant to have the vaccine. And I'd like to just really reassure that group of patients that vaccines, and everyone who's listening has probably had at least one vaccine in their life. Okay. In fact, probably the majority of us have had multiple vaccines. Now, vaccines are thoroughly tested. They will not harm you or your child. And especially when we talk about the flu vaccine, serious side effects are extremely rare. They have an excellent safety record. You may experience a few symptoms that people may be worried about after the vaccine. And that's specifically things like a mild fever, perhaps, aching to the muscles, maybe a bit of soreness to the arm where you had it. And I know when I had my COVID vaccine, it was really, really sore, but I have a very low pain threshold, so I did complain about it a lot. But these are the common kind of symptoms that people will get after a vaccine, but they are transient, they do not stay, and they are not serious.
And that's really helpful to be able to dispel, some of the concerns. I mean, through my vaccines, I was quite fortunate to touch wood, pretty much other than feeling slightly, I wouldn't say headachy, but anyway, I felt slight uncomfortable. Other than that, I didn't suffer any pain, and I was like, all right, that it. I suppose I was almost expecting it to be far worse and have a bigger impact. Yes, I do know others that have had sort of pain in the arm and things like that, and whatever it is. But in comparison to those very rare and extreme cases of sort of really being impacted, the benefit of the vaccine to you and those around you and the wider community far outweighs anything, doesn't it, Dr. Azam?
Absolutely. And, I just want to stress that vaccines are tested. They are, when it comes to the flu vaccine, this is a yearly vaccine that we've been using for many, many years. The side effects I mentioned, the soreness, the muscle aches, relatively uncommon, transient, they don't last for very long. And then you are protected from that year's virus that's circulating. When it comes to children having the vaccine, even better, because there's no needle involved there. There's no pain to the arm, which I'm sure a lot of people might have had after they had their COVID vaccine, or maybe after they had their flu vaccine. So really, I just want to really ramp up people's jabs, and really reassure people that this is an important vaccination. It really makes a difference to people's health, especially if you're at that at-risk category. And I mean, from personal experience, my yearly flu vaccine, I personally never had. Maybe I'm in the lucky category, but I never had any side effects. It was the COVID that caused the discomfort. The first one was fine. The second one was a little bit sore. And I didn't actually get my third one because I got COVID in the end, actually about a month or so ago. And if it wasn't for the vaccines, I think I would have been suffering a lot more. And it's still a horrible condition, even if you've had the vaccines. So I'm going to wait for 30 days after infection, and then I'll be getting my booster.
Okay, no, good. I'm sorry to hear that you'd got it. How was it? How were you affected by it?
It was horrible. It really is a condition that I wouldn't wish on anyone. Actually, it's just it just hits you out of the blue, especially when it comes to kind of muscle aches, tiredness, extreme fatigue, and I mean, I've had a lot of patients tell me about the smell issue. which as a doctor, I appreciate it and discuss through it. But when you've actually suffered it, it's such a strange feeling. It just it just switches off your sense of smell overnight.
I'm gonna have to go on there.
Sorry, Jalf's disappearing, Dr. Azam. So wait, if you're happy to continue
Absolutely.
I'm just gonna only because I'm particularly interested in sort of the broader, wider aspects of getting this critical and key message across, and also to share with pretty much the whole community, regardless of ethnicity or gender or whatever it is, that everyone everywhere is being impacted at variable levels. So you're, sorry, coming back to that question and the impact to you, how long did it affect you for?
It was about a week. I think it would have been a lot worse if I wasn't vaccinated, because a lot of patients that I've spoke to who haven't been vaccinated suffer a lot longer. But yeah, it's the extreme tiredness, the muscle aches. I mean, touch wood, I've been relatively healthy throughout my life and not really had to worry about kind of health issues and things like that. But this just came on out of the blue, and even doing the simple things like hand space and space, wearing PPE, somehow I ended up getting it. Yeah, it's not a nice illness. It must be a lot worse if you're not vaccinated. And I'm hoping now that after my booster, I hope I'll never get it again, actually.
Yeah, no, so do I. I mean, touch wood, I'm very hesitant to say I haven't had it, because I don't want to chance my luck, and we've been quite cautious and careful. But I must admit, the other thing to highlight and recognize is there are other illnesses, and especially at this time of year, being extremely cautious and careful is even more important. My wife has suffered from flu-like symptoms for the last 2-3 weeks. And if I think about if that had been coupled with COVID, God forbid, she would have, God knows how we would have dealt with that. But similar to you, having the comfort of being vaccinated, both of us having been fully vaccinated, there's some reassurance in, right, if we do get it, we're not necessarily going to be hopefully as impacted as those that haven't been vaccinated, although you wouldn't want to wish this on anybody. But one of the other things is going back to the COVID vaccine. I appreciate there still remains quite a bit of hesitancy in a number of communities. And, the thing for me is don't just think about yourself, think about those around you and the whole community as well. It's have some consideration in that regard. And as you say, Dr. Azam, it has been thoroughly and fully tested. It's been rolled out to millions, if not billions by now. Is that?
Exactly. And that's such an important point. There's so many people in the world have had the vaccines now. We just need to look and compare to where we were this time last year to see the difference the vaccines have made, So, this time last year, if we look at cases, hospitalizations and deaths, significantly higher than what they are at the moment. Case numbers are high, and obviously we've got the worry about Omicron. However, touch wood, thankfully, the number of deaths and the number of hospital admissions are significantly lower. And the thing that's changed that around, from my kind of clinical perspective, is the vaccines. That's what's been the big change when it comes to the number of cases that have led to death and the number of cases that have led to hospitalizations, which, as I say, are significantly lower this year. We just need to compare both years to see the difference.
And that's a very, very important point to share and highlight. All the statistics, and and I suppose that has helped inform some of the government's decision, and we're not having a political conversation here, but it's certainly on the basis of the vaccines and the incredible job of everyone within health and healthcare, to roll that out and continue supporting that, which has enabled the government not to immediately move to a full lockdown type situation. Because people are vaccinated, because that vaccine rollout continues, and it is potentially something that we're going to have to live with in any event. I mean, by their very nature, the sort of viruses mutate, as does the flu and whatever else and such like. So getting into a habit of to sort of accept, we need prevention and protection rather than awaiting, sort of a reactive approach. And especially when we're living in such a challenging environment when it comes to sort of the strains and the pressures on primary and secondary care.
Oh, absolutely. Yeah. Yearly issues with regards to stress on the NHS, GP services, etc. And obviously just so much more worsened with the pandemic. But yeah, when it comes to, I just wanted to kind of go over those people who are eligible for the COVID-19 booster. So we've talked a little bit about the flu vaccine, and I'll summarize that at the end. But just very briefly on who should be getting or considering getting the COVID-19 booster. Those people aged between 40 and 49, age 16 and over with a health condition that puts you at risk. So that group of patients that were previously kind of in the kind of shielded category will hopefully have already had their boosters. So if you have been, kind of invited to come and have your COVID booster, please do go for it. And if you get offered to have the flu vaccine at the same time, I would strongly recommend, from a medical perspective, to have that as well. It's totally fine to have both at the same time.
And that's a good point. And obviously, I mean, to say things blatantly, and just to highlight this, Dr. Azam, you're a doctor. You're a medically qualified person with extensive experience and expertise in this field. So if you're coming on and sort of saying, look, it's safe, it's sensible, and we would be encouraging everybody to do it, then naturally, those that may have had some hesitancy by talking to other people who share slightly unusual views. It's through the credibility and the authenticity of an expert like your good self, that should hopefully provide some sort of support and sort of appreciation as to the importance of this.
Well, thank you for your kind words. I just like to kind of stress that trust is such an important thing when it comes to medicine and the patient. And like the first thing that we were always taught in medical school is to do no harm, and that's such an important aspect of our work. And any kind of treatments that we recommend to patients are based on science and are based on the benefit that it will have for the patient. So, obviously, I've mentioned about looking towards last year and comparing it to this year. We can see the difference that the vaccination program, which, we as a country, we did a fantastic job doing that. And we can now see the benefits. We can see the death rates lower. We can see the number of hospitalizations lower. And thankfully, those people like myself who actually subsequently developed the condition, it wasn't as bad as I think it could have been.
Oh, good. Well, thanks for highlighting that. Right. So let's go over the flu vaccine just to try and cover those key points for the benefit of our viewers and listeners as well, Dr. Azam, if we may.
Yes, please. Yes. So flu vaccine, really important to have that done. It's an looked at kind of illness that can cause a lot of serious side effects if you do unfortunately get it. There's still plenty of time to get the flu vaccine. Let's not underestimate how serious flu can actually be. It's free for anyone over 50 and those with medical conditions, as well as primary and secondary school children up to year 11. They don't get an injection; they get a nasal spray, which is a much nicer way to get a vaccine into a child. You can have it even if you're having the COVID vaccine at the same time, and if you're offered the COVID vaccine, consider having the flu vaccine if you're eligible as well. Also, obviously, I didn't mention pregnant women. That's a patient group that really should consider the flu vaccine as well.
And I suppose there have been a number of instances more recently, haven't there, Dr. Azam, around pregnant women sort of sadly suffering because they hadn't been vaccinated, and it's now been fully tested and assured that both the flu vaccine, in any event, for a number of years that's been the case, but the COVID vaccine as well is fully safe and fully tested for both the mother and the baby.
Oh, absolutely. And in fact, if you have the flu vaccine, it does because of the unique bond between the mother and the fetus, there is some protection that's actually offered to the child as well. If you post flu vaccination, there is evidence to suggest some cover over the first few weeks of life to the child as well. So that's a real benefit.
That's a fantastic benefit. And just conscious of the last few minutes of having you on, Dr. Azam, how are you? How's things within the surgery, and how are you
well,
dealing with things?
It's hectic. It's a hectic time for everybody, Ammar. Obviously, there's the demands of the service. The increased demand. It's a hectic time, but it's the same. Obviously, it's what we've been trained to do. A little bit more, kind of stressful perhaps compared to last year. However, we work as a team, and we're getting through things really.
Good. That's reassuring to know. And I suppose any additional messages, anything else that we want to share with both our viewers and listeners, Dr. Azam?
Well, obviously, what we've already discussed about getting the flu jab is the main thing that I really wanted to address our audience today. Obviously, the COVID-19 booster program, it's going to be something that we really need to focus on and ramp up if we're going to see a return to some normality, hopefully next year. But yeah, that's the two real issues I wanted to go over. And thank you very much for your time to allow me to address that.
No, and thank you very much. And please use this platform as your own, not just about these key and critical messages. Anything else, any other advice that you could give to our listeners more generally, generically, this time of year? Dr. Azam, what should we be doing more of and less of?
Well, hand space and space, that's really key. Looking after each other as a community, really important. Being there for people who may be having a more of a difficult time. It's a stressful time of the year, coming up to Christmas, and just looking after each other, I'd say.
Wonderful. And hopefully there's lots of people looking after you as well, Dr. Azam.
Well, chance would be a fine thing, but yeah, I suppose.
No, thank you ever so much once again. Really grateful for you giving up your invaluable time and scheduling this in to your, I imagine, jam-packed diary, to help reinforce this message and share more broadly the importance of, getting vaccinated looking after each other and looking after yourself, through this. Thank you ever so much. And I suppose if people want to find out more, generally for authentic information, NHS website is probably a good.
Absolutely, yeah. There's the NHS website. That's an excellent source of information. And there's also patient.co.uk, which is something I highly recommend people to look at. You can search for any kind of health issue, and it gives you up-to-date, evidence-based, verified information.
Fantastic. So NHS and patient.co.uk. Thank you ever so much, Dr. Azam. As I say, very grateful, and wishing you all the best in both your day job and also hopefully that you get some respite over Christmas even for a little period of time and get some time to sort of look after yourself as well.
Thank you so much, Ammar. Thank you for the time today.
All the best. Take care.
Bye.
Bye bye. And there we have it, Dr. Azam, sort of coming on to our show to share the importance and the criticality of getting vaccinated. And by doing so, you can see the impact versus those that haven't been vaccinated and the ability to get back to work. I imagine if Dr. Azam hadn't been vaccinated, he wouldn't be out there helping more people, saving lives, literally, and supporting the whole community. Coming up to the end of the show, you've been listening to Ammar and obviously Jalf, who had to leave. We'll be back next week, where we'll be talking about plans for 2022, as well as reviewing what's happened in 2021. You've been listening to Ammar Mirza live on Spice FM and broadcast on YouTube and various other channels.
Your only Bollywood station in Newcastle. Spice FM 98.8.